Hello, good evening, and welcome to another edition of Ion Port. It is proudly brought to you by GOIL Company Limited, the Ghana Revenue Authority, the Ghana Ports and Harbours Authority, Serene Insurance. Media partner for the program is the Business and Financial Times, as well as Ghana Web, Business 24, the Graphic Business, and a host of others. If you turn to Ghana Television on Wednesday at 8:30 p.m. you should watch a abridged version of this program. Also get a copy of the Thursday edition of the Business and Financial Times, and you should read a lot about this particular program and the happenings within the ports and maritime industry, as well as Ghana Web. Virtually everything that transpires on this platform, Ghana Web has it on there. We are going to talk about COVID once again because it is important. Quite a number of cases we are recording in the country. Our president spoke last week, and the statistics were very gloomy, arguably, and it's not getting any better. The statistics we're recording on the national pages of the Ghana Health Service is not any pleasant. The port industry have also some interesting statistics, and we're going to learn about it today. We're going to see how best we can also manage ourselves to prevent getting into trouble in this particular case or pandemic, and then be able to engage in business for ourselves, for our country, and for our organizations. That's the business for today, and we have the right man who will be engaging in that particular business with us, with some serious numbers that you'll be surprised seeing them, but it is important that you get to see them. Ion Port returns pretty shortly after the break.
Every now and again, GOIL makes good things happen. This time, GOIL has introduced Super XP Ron 95, a higher grade fuel loaded with additives and yet sold at the same price as normal fuel. GOIL Super XP Ron 95 enhances engine performance like never before. It maintains the engine by keeping it clean from carbon deposits. GOIL Super XP Ron 95 is designed to burn slowly and thus improves fuel economy, making you save money after several kilometers. GOIL Super XP Ron 95 gives you a smooth driving experience, that is, less vibrations. Fill up with GOIL Super XP Ron 95. Now there's no need to pay more for any higher grade fuel. GOIL has that sorted. GOIL, good energy.
Electricity, then pay your taxes. Our taxes, our future.
Because you see, without our taxes, we wouldn't have good roads, good schools, better hospitals, street lights, and other very important social amenities. When we pay our taxes, we give our children free and quality education. Talga, my money too small. Why should I pay my tax? Look, small. Salifo, it doesn't matter how small or big your business or income is. You still have to pay your taxes. The little taxes from each and every one of us, when put together, could give your community clean water, or that deprived school with tables and chairs. Please pay your taxes. It is your responsibility. It is your civic duty. It is the law.
Oh, how are you?
Hi Yvonne, a few words please. Everyone is talking about the fire at your production house last week. How are you holding up? Has production stalled?
No, not at all. My crew and everyone on my set is perfectly fine because I insure with Serene Insurance. As a matter of fact, I've had all my equipment replaced, including the vehicles that were affected. My workers have been sorted out. Even my production downtime has been covered. So it's all good. I have a meeting to attend to, so I have to get going. Sorry about that.
Which insurance company did you mention?
Serene Insurance, the new face of insurance, a member of First Sky Group.
Welcome back to the program. It is Ion Port live in the studios of Metro Television this evening. My guest in the studio is Dr. Victor Vitus Anab. BC is the General Manager, Health Services, Ghana Ports and Harbours Authority. He's MD, that's medical doctor, MPH, MBA, Masters in Business Administration, Health Services Management. Of the Ghana Ports and Harbours Authority. He's been doing significantly well when it comes to the health services situation around the port and harbours industry. I recall that 2019 2020, the beginning, when we all had this pandemic fresh, not even the country had recorded any figures. It was all over in China, but we had just had it fresh. He began with his team moving around everywhere around the port industry, educating and sensitizing folks around it. Doctor, pleasure to have you in the studio.
Thank you, Sammy.
How do you find our new space? Look at the distance. The last time I met you, were as close as that.
Exactly. This is a fantastic environment, and I think it's very serene, as serene insurance.
They'll be happy to hear.
Yes, it's a good place. It's good.
Okay. So we are going to talk about most of the numbers that we are hearing now, the statistics we are hearing. I'll let you start off with the general statistics, and we have some figures coming from the port environment. We would love for you to take us through them as soon as our techie is done putting them on the screens, and then give us a sense of why we are seeing these numbers and the way we are seeing them. Yeah. Let's start with the national numbers. Do you know where we are at this point?
Yeah, thank you, Sammy, and good evening to our viewers across the country and probably internationally. You pardon me for not seeing my face. I definitely have a very handsome face, but I've covered my face up in two face masks. It's not for fun, but it's because of the situation at hand.
Yeah.
So you pardon me, but I hope you are hearing me loud and clear, even though I'm speaking through my mask.
We are.
Yes, Sammy, indeed, I like it this way. We are so far away, more than the recommended 2 meters apart, which is excellent. But that notwithstanding, I'm still insisting we put on the mask because we are in a very enclosed environment, air-conditioned. And of course, if any of us has a virus, obviously we'll be producing aerosols, droplets, which will remain in this room, and the air condition picks it up and circulates it, which is not to our good anyway. So thanks once again for the first question. You're asking me about the current situation, about the national numbers. Indeed, I'm sure every single Ghanaian, or most Ghanaians, have interest, and they're tracking the figures that are being churned out by the Ghana Health Service and the Ministry of Health in connection with the COVID-19 situation in our country. Yes, indeed, they are overwhelmed, and they are doing their best to give us current update every time. But because a lot of organizations are not reporting and are not updating their figures with them, they will find it difficult getting. Because if they do not get the statistics from the various private clinics, from the various other health facilities, they are unable to actually get the current in terms of maybe current by the minute or by the hour reporting. So they are doing their best. So the figures, as we all know, which we all try to go to the Ghana Health Service website to see, currently in Ghana, if you would oblige, I would just give you the world figures, then I'll go down to Ghana.
Please.
Yes, so the world figures we know, if you go onto the WHO website, that's the World Health Organization website, you would realize that we are hitting almost 105 million confirmed cases.
105
that is it, 105 million.
Across the world.
Across the world. Specifically, it's 104,956,439. But these figures keep increasing by the minute. Okay? These statistics I'm sharing with you is as of today, 10 a.m. As of today, 7th February, 10 a.m. And from that time to now, new cases have been confirmed, isn't it?
Yeah.
And also new mortalities or new deaths. So what we have, that's the world picture. And total deaths of about, out of the almost 105 million, total deaths of about almost 2.3 million deaths. That is huge. That is huge.
No, let me get it. The first figure you mentioned, is it billion or million?
Million.
Million.
Almost 105 million Ghana. 105 million confirmed cases.
Okay, and then you said the
deaths.
The deaths.
The deaths is about almost 2.3. It's 2,290,488.
Which means that I'm getting that the first figure you mentioned is billion, 1.5 billion. Yes.
No. Okay. I'm saying 105.
Oh, 105.
105.
Okay, I thought 1 million.
No. 105 million.
Okay,
yeah,
okay.
Yes, 105.
Okay, 105.
Yes,
and we have about 2 million or so deaths. 2.3
million deaths.
Okay.
All right.
Okay.
And new cases within 24 hours, the last 24 hours, we're looking at about 460,000 plus.
Okay.
Almost 470,000 new cases. All right. Then the new deaths also over 15,000 deaths within the last 24 hours. Those are huge things that we should not be joking about. But if we want to narrow down to our beloved country, Ghana, as of today, at least we have confirmed cases, total confirmed cases. That means since COVID started in 2020, we have about 70,000 cases, specifically 70,046 cases confirmed. That means samples were taken to the testing centers, and indeed those who have reported positive is about 70,000. That is Ghana for you. All right? Then out of this, about 63,500 cases recovered, and we have 449 deaths. That means almost 450 deaths. That's in Ghana. That is the last statistics that were churned out or were given by the Ghana Health Service, and that's indeed on their website.
Okay.
And they've told us that active cases are at 6,095. You can see the number. Active case means people are still sick. People who are sick is about 6,095. And then the new cases is 791.
Okay.
This is from the Ghana Health Service website.
This is the national
statistics. National statistics, yes.
Okay. And let's bring it down before we get into other areas, the new variants and all of that. We're going to bring it down to the ports.
Yeah.
So during the DEBA, the staff DEBA that you had at the port, you mentioned quite a number of figures. Some were reported in the media. We had some reports that were contrary to what you had put out. If you can give us a picture of what we have from the port, and I think I have it. Frank has been able to put it together on the screen. Let me just go and see if we can. So this is supposed to be COVID-19 situation in the port community as at 7th February 2021 at 10 a.m.
That is today.
That is today.
That's right.
Okay. So we have the month, we have the samples taken, the number tested, positive, negatives.
And then percentage positive.
And then percentage positive.
Correct.
So the total that I see for samples taken is 2,328.
Correct.
Which is the number of samples you have taken all in all.
No, that is within the port community.
Within the port community.
We have more than that. We have private cases coming into our clinic. We've tested them. So that is a different table. I will show you. But this is specifically, if you say port community, you have Ghana Ports and Harbours Authority.
Yeah.
You have the Tema Shipyard. You have the MPF, which is the Terminal 3. You have Antrak. You have other, related stakeholders who are doing business in the port.
Okay.
Yes.
So these are the stakeholders within the port who are coming to your clinic.
Correct.
For the sample taken, and you have 2,328.
28, yes.
Out of that, numbers tested 2,081.
That means there's a lag there
between samples taken and then the
there's a lag because some are still pending, isn't it? Some are pending. Some results are pending.
Okay.
Because we see in our clinic, we don't test. But the good news is that, and I'm going to make this right now. Good news is that right from next week we'll be doing testing in our clinic.
I see.
We'll be doing testing. So that will even enhance
that's a big news now, because a lot of people know that where we test is the Noguchis and all the other centers.
Correct.
And I think along the line we added the veterinary services. You're saying that the Port and Harbours Authority, from your outfit, the health services, you are going to begin testing?
Correct.
I see. You got that mandate now.
We see it's because of the numbers we're getting. They are so overwhelming that we need to do one thing. Don't forget, we are also a border. Point of entry, just like the airport. Is that okay?
Yes.
So we are looking at putting in place the antigen test or the similar test that is being done at the airports.
Okay.
Is that okay?
Yes.
And which is perfect because this is a screening method. You do it for a lot of numbers. And if you get those who are positive, and indeed you still want to do confirmatory test by the PCR, then you can do that.
Okay.
But it is equally good. And once we get, and you know that when we test, say, a staff of GPHA and the person is positive, we'll have to run up and do what? Contact tracing within the department, isn't it?
Yeah.
And wherever that person has connections with in terms of work. So imagine the number of people who come to us in the clinic, Federal Department. When you come and we are going to do contact tracing, when we take your sample, you have to go home. You can't go to work.
Yeah. And how long do you have to go home for?
Minimum 7 days, because we expect that the results should come within 7 days, which is 1 week.
Okay.
Sometimes it can be more than that, sometimes it can be less. But we give you 7 days, that means what? The authority is losing economic manpower hours.
Yeah.
And that is not good for the authority.
And aside their colleagues in the departments and the office space, you also extend the tracing to their families.
Certainly, certainly. The tracing begins with the family or the household. Okay? That tracing begins. So we are still doing, I will come to that and tell you how we do our contact tracing.
Okay, we'll get to that point, but let me deal with the numbers that you have here, and then we can equally move to some of the graphics that I have seen you have.
Yes.
So this figure that we are seeing, the samples taken so far, the numbers that have been tested so far, this is from when to when? This is from last year?
January to January. Last year, that's January 2020.
Yeah.
Till, I think...
we'll say March because Ghana started recording.
Have you realized that in January it was 000 throughout?
Yeah. Okay.
But in February we had one.
Oh, I
tested.
see.
Have you seen that?
Yes.
Exactly. Because there was a suspected case in February, as you rightly said.
Yeah.
Even before Ghana had their first case.
Yeah.
What happened was that we had a suspected case on board a vessel. That's a ship.
Yeah.
And the symptoms were so classical and they're so consistent with what? COVID-19.
Yeah.
So quickly, we had to take samples for testing.
And
so
it ended up to be...
It ended up being negative.
Zero, so it wasn't positive, it was negative.
It was negative.
Okay.
All right. So you see that we started very, very
early.
Even before the country came out with the first 12 cases that was announced what, in March, isn't it?
Yeah.
The first 2 cases positive in March. But we had already started in February.
Very interesting. And
yes.
So your positive numbers, you have 380 positive folks.
Out of the 2,081 who have been tested. Correct.
I see.
It could be more because if they send us the pending ones, there could be some who will be positive.
Okay, but we're talking about what, as of now,
Correct.
what we have.
Yes.
And this includes me, though. I know that the positive numbers here, the 380 includes me.
It includes you, yes. Well, if you want to...
we'll talk about that later on. Okay, so then the negative numbers, you have 1,701.
Correct.
And then the percentage positive is 18.3.
18.3.
Interesting. So in March,
yes,
you had recorded, that was March is when the whole country recorded the first.
Correct, yes.
And you recorded 1 case in March.
1 positive.
Okay. In April, you recorded 1 positive.
Another 1 positive, yes.
In May,
look at the number.
34.
34, yes.
Wow.
34.
It just shot up like that.
Exactly.
I see.
Yes.
And then in June, that is where I came in.
Yes.
175.
It was too bad. That was where, even in the whole country, the COVID-19 as of last year peaked in June. The positive numbers or the confirmed case peaked in June. But if you look at the numbers we tested, you look at the numbers. 568 samples were taken. All of them were tested.
I see.
And then out of that, 175
tested positive.
Yes, that was that's huge. And what was the percentage?
The percentage is 30.8%.
That's quite a significant number.
Wow. And then in July, you came to 202 samples taken, 202 tested.
Correct. That's right.
45.
Positive.
What happened in June? How come a lot of the folks there in June, 175 against, so it started dropping. If you look at it, from June, 175. In July, it dropped to 45. In August, it dropped to 30. In September, it dropped again to 7. So from June, it started coming back down.
Exactly. That's why I said it peaked in June. But if you look at the numbers, the samples taken it's also dropping, isn't it?
Yeah.
So it depends upon the number of samples taken, whether there were suspected cases or contact tracing. We've added this together because all we wanted to know is that, okay, we've tested these people. Out of that, how many are positive? So some of them are contacts, others are what? Suspected cases.
Yeah.
So I want to stress on one thing. So if you see that it dropped, all right, all the way from July, dropping. But look at October, 149 again.
Yeah.
Then November, 214 tested and 23.
Yeah.
December, it dropped. Even though we had about the same 220 tested, isn't it?
Yes.
We had 19. There was a dip there.
Yeah.
Then in January this year, all of a sudden, and it's clear for everybody to see, we tested 175, even though we took samples for 307, only 175 were tested out of that, and the positive number was 33. So it shot up again from 19 in December, it went 33 up to 33
in January.
That tells you
what could have been the cause? A lot of chilling?
Thank you.
People enjoyed.
Well, December is a month full of fun. Yeah. And this year in our country, we know we had what?
Elections.
Political elections.
Yeah.
Party politics. And so there were a lot of that. People also had what? Weddings in December.
Yeah. Families returned from abroad and all
people were congregating, a whole lot. It looks like people had forgotten that COVID was still around.
Yeah.
So people started having weddings, funerals, people were attending funerals a lot, and then also political activity. So if you bundle all that together, indeed, you saw that that is now reflecting in what? In the January figures.
Yeah. So we have 0 so far because it is in February, because we just have 7 days only in February.
Correct.
And maybe you haven't received
our results.
Your results.
But you've seen that we've taken, already we've submitted 102 samples to Noguchi and some to Kolebu. And then out of that, only 22 have been tested. So the 22 tested, they are all what? Negative.
Yeah.
So that's the figures we're having.
Okay. So I'll come to you about January coming down.
Yes.
So the 33, which was
positive in January. 33.
Positive in January.
Correct.
From the 19 in December.
That's right.
And then what I would want to find out from you when we get to that point will be whether these 33, are we seeing some of those new variants that we've been hearing about in there? That I'll come to you. But just let's get back to the whole thing again. We have the highest number recorded in June, 175.
I'm saying that this is what we have in our clinic, Ghana Port and Harbours Authority Clinic in Tema.
Yes.
But it is a reflection of the what? The national
situation.
Is it? Oh, yes. The situation in the national
that was going to be my next question.
June,
is that what happened?
It peaked in June, nationally. Yes. So, again, we are part of the country. Yeah. And all this, our statistic is also fed into the what? The national
statistics.
Yes, obviously.
I see.
Yes.
So, 30.8% is the highest we ever got.
Correct.
Dropped 22, dropped 19, dropped 7.3, dropped 8.1. What do you think we were doing right to bring all these numbers down then?
Thank you, Sammy. Indeed, when we started in March and the news came and people were all eager to know what COVID-19 is all about, people were interested in know, okay, what can I do to protect myself and my family and my work colleagues? So people started taking interest in what? The preventive measures, isn't it?
Yeah.
So they went on and on. But again, along the line, as human beings as we are, obviously people started relaxing. Because they say, oh, after all, it's not that bad. Koro, as we popularly call it in Ghana. There are still a lot of people here in Ghana who still believe that koro doesn't exist.
It doesn't.
Or they say it's a disease of the affluent.
Yeah.
That's what people say.
Yeah.
And say, oh,
sometimes when you go to the outskirts of town, they tell you that, oh, more moving crying.
Exactly.
Mona, you have it.
That's the point. But unfortunately, that's not so. COVID-19 is no respecter of persons. It's no respecter of social status. It's no respecter of religion or anything. So, indeed, so people started relaxing. And so the virus started doing what? Getting back to us, isn't it? But initially, people were obeying. And also, don't forget that the government came out with a lot of restrictions, okay?
Yeah.
To protect us.
Yeah.
There was a lockdown, total lockdown on Accra and Tema.
Yeah.
That did a lot because the national hotspot is still Accra and Tema, isn't it? All right. And it remains so.
Yeah.
For obvious reasons, because the population of Tema and Accra put together, we have the highest population, isn't it? And also, there's a lot of what? Activity in Accra, Tema.
And there are people who have called for the fact that, from what you have said, because there are a lot of red flags in Tema, in Accra, Tema, and Kumasi. Why don't we shut these cities down? Do you think that we are getting to that point where that may be required?
I'll leave that to the advisors, national advisors, but I think that we are at that point.
I see.
And indeed, probably they're preparing to tell the president or to give him the situation on the ground.
Yeah.
And so possibly he might consider. Because yes, the figures are there for everybody to see. When we get to the details, I can share that further.
Okay,
yes.
So let me let you speak with this curve, which is basically what we have, the numbers we have spoken to.
Correct.
So from January 2020 all the way to April 2020, the curve was flat.
Correct.
And then it went and peaked, and we couldn't flatten it all the way down from July to December. However, it was a bit low.
Yes.
Yes. Even though it kept going up and down and all of that. But
that's right.
We could never flatten it. Could we have flattened it?
Yes and no. We could have so many factors that have to be in place. First of all, we as a citizenry, we should obey the instructions from government and from the health workers who are advising us and telling us what we should do. Preventive measures, I think that largely, majority of people know what to do to keep themselves safe from COVID-19. But the question is, we are relaxed. We don't apply them to the letter. That is one. Two, of course, the health system that we have, the thing is, if you are sick and you have confidence in the health system and you go to a health facility on time, you report on time, and it's picked out as COVID, then you are isolated.
Yeah.
That will prevent transmission. But the point is that there are a lot of people who still believe in alternative medicine.
Yeah.
They will not come to the health facilities.
Yeah.
They will rather go to prayer camps. They go to other faith-based organizations.
Yeah.
And when the situation is now out of hand, that's when they now find their way to the hospitals. And by that, which time it was too late.
Yeah.
And over there, at the prayer camp, they would have done what? Would have also spread the virus, isn't it?
Yeah.
So there's all mixed.
Yeah. So could there have also been policy direction that could have pushed us to straighten this a little bit? I mean, we knew that we had elections coming up.
Yeah.
We knew that we had festive season coming up and all of that. Could we have, as a country and from policy perspective, put in certain measures from that time, even though we're enjoying that kind of steep descent, we could have still put in some measures that as soon as we get to the lowest we wanted, which was somewhere around September, it stays right there all throughout till the end of the year?
Yes, we could have, but then it had to be a two-way thing. Whatever the
people and then the policy.
Thank you. So
but did we get the policy to direct the people to do it?
Enforcement.
Okay.
Enforcement is an issue here, number one. Because if the government has come out and told everybody what to do to keep their figures down or to keep themselves protected, if we as a people are obedient, are disciplined enough, then we don't actually need somebody to whip us to be able to do what we are supposed to do. But unfortunately, you can't expect everybody to do that.
Yeah.
Okay, over 30 million Ghanaians, everybody will not behave correctly. Yeah. So obviously, policy is there, but implementation of the policy one. And don't forget, implementation of policy comes with cost. And so indeed, government put in so much from the beginning in order to get things down. But the question is that, was it sustainable?
Yeah.
Probably government also needed some support from private sector and from individuals so that we are non-disciplined enough to do what is right.
Yeah.
But some people, you'll be surprised today, might still be waiting and hoping that government will come and give them PPEs to wear. They are not ready to invest in that. So there's so many, there are I'll say a multitude of factors which accounts for this. But the major one is that people are simply not disciplined and they're not doing what is right.
Yeah.
Of course, for the government could also be harder on their enforcement and make sure that the penalties are quite steep and the penalties are deterrent enough.
Okay.
So maybe we should look at that.
Yes, I will come to you on also the strict policies when it comes to the port.
Yes.
To ensure that in your corner, you are also able to straighten this. If there's any more that we will have to deal with in terms of the statistics, I'll be glad that you speak to it just in about 2 minutes or so, and then we can commence the other area. Because
just leave this
there's something you also mentioned during the debate that struck me, that there's no death recorded, no fatality when it comes to the number of figures you recorded in the port environment.
Correct.
Is that true?
That is true. That's true. And I just thank God and I thank all stakeholders who cooperated very well. And then also, of course, the greater thanks will go to our top management and the board who provided the resources for us to do what we're doing now.
Yeah.
Because without resources, you can't do any of this.
Yeah.
You agree with me that from the beginning, when we even started doing the sensitization across the port community, you were part.
Yeah.
Okay? The PR and marketing, we did it together with the health department, isn't it?
Yes.
And you saw the amount of money that was pumped into it.
Yeah.
We didn't wait to get any directives from national. We came out with our own policies, and they were what? Definitely those policies came out, and even the EU, when the EU came to us, after about 2 months, we had already come out with our policies, and there was nothing they could take away from it because everything was in line with what the European Union was recommending.
So from January 2020 to February 2020,
correct.
No staff of your authority has
no
passed.
Staff. No staff has passed. There are quite a number. The statistics will tell us there were a number of staff and dependents who got infected.
Yeah.
But
Which
no staff died. I repeat, no staff died. We didn't register any mortality.
Good.
Among the staff of GPHA. We didn't register any mortality.
Okay, what about your stakeholders then?
The stakeholders, from the statistics I have, I know that one dependent died, another one from another company. I can't mention the name of the company. So, but all in all, I can say that less than 5 people within the port community might have lost their life. But in GPHA, Ghana Ports and Harbours Authority, no staff died.
You never recorded any deaths?
No staff died. And looking at this figure, if I may speak to this,
please.
Indeed, this is very important. People should watch it very carefully. We said on board. On board means on the vessels or on the ships, isn't it?
Yes.
Samples taken so far, 272.
Yeah.
Total tested, 266. And out of that, we had 10 positive.
Yes.
Okay? This is on the vessel.
I see.
Yeah, and what
so
happens?
These are crew members who have come into the country On-board vessels?
Correct. Not coming to the country.
I mean, they are on board the vessel there.
That's right. So this is our, and you know our policies, later on I'll speak to them. But indeed, before any vessel comes into Ghana, the policies that we put in place says that, look, this is the protocol. 7 days prior to your expected time of arrival, which is called the ETA, the captain of the vessel is expected to do what? To send us electronic or email information as to how many crew on board. In fact, there's a form that they have to fill and send to us electronically or via email so that we can monitor and see, okay, indeed, it's everything. So the question there is a questionnaire. So you fill it, we vet that, okay, and it's a whole committee vetting it. I happen to be one of the members of the committee, and I am the incident commander, and I do most of the medical review. The other part, other members contribute. So when we look at it.
So you've got Navy on board, you've got Customs, you've got
the composition of that committee.
And all of that.
The committee is called the Ghana Ports and Harbors High-Level Interagency Committee. And members of the committee, GPHA staff, you have Customs, as you're saying, which is the GRA. You have Immigration. You have National Security. You have Marine Police. You have the Ghana Navy. You have the Veterinary Services. All right, all these people are part of our committee at the headquarters level. So if you look at this, that means that we screen this. Sometimes when they are coming, we all know that the port never shut down, unlike the airport, which was closed for some time, isn't it? But the port will never shut down for a whole year since last year.
It's been open to business all
It's been open to business all along. If we have to shut down the port, that means that the economy of Ghana will grind to a halt.
Of course.
Because most of the economic activities, you know, we facilitate what? Trade, isn't it? And most of our goods come through the port, right? And these are essential goods, okay? So we never shut down, even throughout the lockdown. But what did we do? The policy said, now, instead of seamen coming with the vessels and getting off and entering our country, going to the duty-free shop to buy things, we stopped that. When your vessel comes into port, you remain on your vessel. We have welcomed you, but you cannot come down. You cannot enter our country. You have no business entering if you are not sick. If you have nothing to do, remain on your vessel. They will discharge your goods, load your ship, and you're going back. But why do we have these figures? It's because some people, we could have suspected cases on board. And then we gather that from the information that we are teasing from them earlier. We will have to screen those people. So if we have suspected cases, when the vessel comes, it doesn't even come to port. It will dock at, where? It will be at anchorage. To berth at anchorage, you remain there. We'll go on board the vessel at the high seas. Pick the sample and send it for testing. If somebody happens to test positive, then all the crew members on board that vessel are what? Are tested. That's how can we have these figures.
I see.
And also, there's something called crew change. Crew change means people on board, the seamen who have to disembark or come down from the vessel, and others board. So those coming down are called off-signers, and those going on board are called on-signers. Indeed, when they opened the airport again, people started coming. But even before the opening of the airport, they were coming on special flights. They will fly in specially, but by then we would have screened them also again, check their status, the COVID-19 status. And then we do all that, call the crew, change, we do all that, and also that comes out with some numbers. And so that's why we have those figures there, even though we don't allow them into the country. But the 10 positive, I'm sure you're going to ask me about the 10 positives.
The 10 numbers is a positive numbers.
They're positive.
But that's good. It's, even though it's not too good, right? It's impressive to know, because on our international port news that we've been playing since last year till now, we always hear quite a number of crew members who get sick on board, and even sometimes it's difficult to evacuate them and all of that.
Correct.
So you're saying that out of 272 folks that you, crew folks that you have screened, or 266 that you have tested, only 10 tested positive.
10 came out positive.
I see.
And what happened to those 10? Once we know that you're positive and you're on board the vessel, there's a very, very strict protocol that you have to go through. Those who are not very sick clinically are taken to an isolation center. So we then, we get involved, we get called the Municipal Health Directorate involved. That's the Tema West. We belong to Tema West Municipal Health Directorate. So they come, they get involved, and so they take down all those people, disembark them, and they will use special ambulances under special cover. People don't fully. All the protocols are observed, and we send such cases to isolation. That's those who are not sick. But those who are sick and need admission, or they need hospital care, and need treatment, indeed, we send them to either, we have International Maritime Hospital, which is a COVID treatment center, or to Noguchi, to UGMC, which is the University of Ghana Medical Center, or to Ghana East. And these are the people who have helped us through. And also, Tema General Hospital, they have a treatment center. So if you are sick clinically and you need treatment, then we disembark you and send you, observe all protocols to the treatment center. But if you are not sick, you go to an isolation center. Okay. You spend 2 weeks in the isolation center, and when you are cleared, they retest you. When you are cleared, then you find your way to your country.
I see.
Yes.
Very interesting. But let me let you run through this one quickly.
Yes.
I don't know if I have to do the other one, but
no, the other one.
This
yeah,
one,
this
I think
that's
is
fine.
okay. So confirmed positive COVID-19 cases as at February 7,
Correct.
10 a.m. You have 1 GPHA staff and dependents. You've got 279. 46.7% is what it is.
Correct.
You've got 20, private folks, 222 numbers. 37.2
Correct.
is what have tested positive so far. And
yes.
3, you have corporate organizations that includes names you have mentioned here, PSC, GMA, MPS, GSA, MDU,
Correct.
PFS, all these companies, 86.
Yes.
And 14.4 folks
yes.
are tested positive. On board vessels, crew members, that's what we just talked about.
We just talked about, yes.
10.
Yes.
Out of that, 1.7 is the percentage. So total is 597 positives,
yes.
is it?
Yes.
And then that's the 100%.
Correct. So, Sami, so this is a table that people should pay attention. You look at it. So now, in my clinic, GPHA clinic, Tema, total positive as of today, 10 a.m., we have 597. We are almost at 600 positive.
Okay.
Is that okay?
Yeah.
Because we've tested almost about 4,000.
Yeah.
And out of that, almost 600.
And to get it straight and clear to everybody, that's not supposed to be only GPHs.
No, that's why I want to highlight.
It includes private folks, corporate organizations, and quite a tall list of corporate organizations.
Correct.
And folks who are on board vessels as well who have come in.
That's right. And I want to make it clear that, you see, if you look at the figures, GPHA staff and dependent, meaning our staff and dependent, because our clinic primarily is for our staff and dependents, okay? So they patronize us a lot.
Okay.
But we are open to the general public. That's how can private people come there. And also other corporate organizations patronize us, like MPS, Shipyard, GMA, that's Ghana Maritime Authority and others. So this, to make it clear that these numbers are not GPHA staff only, but it's a mixture. Even though we are in the majority, if you look at it, because, of course, it's our clinic, and majority are students. And don't forget, GPHA staff, we are numbering almost 3,000 in Tema Port alone.
Yeah.
So that's a huge number, isn't it?
Yeah.
And now look, this figure here, as you are showing us, total, as I told you, is 3,500, almost 3,600 cases.
Yeah.
Samples taken so far.
3,253. And total
tested.
confirmed.
Total confirmed is the 597 that we just saw.
Yes.
And negatives is there. So positive rate of 18.4%. That is very high.
Very beautiful. So I think that puts the numbers to rest. Let me just get back to seat and then let's deal with some of the measures you have put in place and in handling the COVID situation going forward. So for those who were wondering, particularly after your speech from the DERBA, there were quite a number of misrepresentation out there, and I needed you to clarify. It's pretty what we are seeing. But what have you also done that has made you seen almost no deaths? The fatality rate is almost zero.
Yeah, it is zero, not almost.
What do you do?
Thank you, Sami. It's simple, as I said. The authority, top management, the Director General and top management, with the blessing of the board, put at our disposal enough resources. You know that it's not cheap to buy this PPEs, that's the personal protective equipment in jail. The mask, the gowns, and all that. Surgical gowns, at the peak of everything last year, you saw how people were making brisk business with all these PPEs. But the authority did not relent. Even though there was no budget, they came out and straight away provided all that we asked for. But we quickly put in place policies. First of all, we went around and did sensitization of the entire port community. We didn't leave any stakeholder out. Everybody was covered. We told them what COVID is all about, the preventive measures, and what they should do to constantly keep safe at the workplace and at home. So that word went round, and you kept playing it on our intranet, isn't it?
Yes.
And that is also a very good source of information.
Yeah.
The problem is that if you have information, people die for want of what? For lack of information. But if you have information and you actually use that information, definitely you protect yourself.
Yeah.
So in addition to the information we gave out to people, of course, the authority provided us with all the PPEs. So you see me wearing double mask here.
I was coming to it.
Yes.
Is there a new style, or that is what we should be doing?
Well, if you work in a very, I would say, a very risky area, you should be doing this. This is the highest level, maybe level 4 kind of protection.
Can you breathe well?
Very well. You can see I'm talking comfortably. I can breathe well. Okay? We started even using it before even people like Dr. Anthony Fauci came out and recommended that we should be wearing 2 masks. If you know that, internationally it's recommended.
Yeah.
But we started doing this. I gave 2 surgical masks. What you are wearing is called a surgical mask.
Yeah.
I gave 2 to each staff of ours. Every day you are giving 2 to use.
Yeah.
So they'll give you for a week. If you are on duty 5 days a week, we'll give you 10.
10.
So every day you must wear 2. Because I thought that 1 is not enough to protect. Because it's not 100%.
Yeah.
Okay, we know that. So if you have the 2, you are better off because we are working in a health facility.
Yeah.
Apart from having enough PPEs to work with, again, we make sure that at every entry point in the port, we had what? Places where they were checking temperature, they were doing hand sanitization, I mean washing of hands under running water, and of course with soap, isn't it? Yeah. So, and you know that all across the port, that's what we have. Yeah. We're using polytanks instead of Veronica buckets, so we call it Veronica polytanks instead of Veronica buckets. So we have that. And then we train the security people to be checking the temperature so people enter and exit the port. Yeah. So all these are measures that we put in place. Then apart from that, remember that we have no mask, no entry policy in the authority.
And almost all
our offices.
Yeah.
There are stickers, there are signages there, no mask, no entry, and we implement that to the letter. Then at our clinic, when you come to our clinic, when you enter, we've put certain measures in place. You can't just come and then just go to the medical records and take your folder. You are, first of all, you have to wash your hands, sanitize, then you approach. And then they take your folder. You don't go there. Folders are picked for you, and we put the people outside, and we'll call you numbers of maybe 2 or 3 people to come into the OPD area at a time. Yeah. So we really minimize what? A lot of congestion at the clinic. Okay. So, it's where you have congestion, that is where what? The spread is likely to happen, or transmission is better when there is a lot of crowding.
Yeah, because I chanced on a radio frequency, for instance, and the discussion on there was that, if you want to know where a lot of, and this is as current as this week. Okay. But if you want to know where a lot of the Chinese people are, is at the Tema Harbor, the fishing harbor. You see a lot of Chinese people. Right. So even from the beginning, the perception out there was that is where a lot of things will come from. And I'm seeing your numbers now, and it's on the contrary, very impressive how you have managed and handled the situation there. I want to know what you are doing next. Now that we have all heard about the new variants and all of that, I'll come to you. Yeah. I asked you about the numbers dropping from, if you take the 2021 numbers. Correct. So January, we see the numbers getting back up and all that. Does it include the new variants? Have you recorded any new variants?
The truth is that because our clinic, we don't do testing. And as for sequencing, the gene sequence of the virus is done only at Noguchi, as far as I'm concerned. Okay. And so even before coming to the studio, I cross-checked with Noguchi, and what they could tell me, they confirmed that, yes, indeed, we have the British or the UK variant here. And that is what is accounting for most of the current cases that we are seeing. Okay. And
but they couldn't tell you whether your numbers that you have recorded include some of the new variants. Okay.
Not specifically. Okay. And I was looking out for even the South African variant because we had got 2 confirmed cases on board the vessel from South Africa. I see. The vessel came from South Africa, and there were 2 confirmed cases who were disembarked and sent to our hospitals. So the samples are, and say they are yet to come out with the gene sequencing for that to confirm whether it's a South African variant or otherwise. So that one. But you see, they're also working according to protocols, and they're overwhelmed. They're overwhelmed, so we have to give them time to do that. Okay. So definitely, but they can confirm that most of the cases we're seeing now as the UK variant. Okay. And we know the UK variant has what? It's more what? Infectious. The infectivity rate of the UK virus or the UK variant is higher.
What about the SA one, the South Africa one?
The South Africa one, I think the UK one is higher than. Say higher. The only thing is I think the South Africa one has maybe the vaccine is still something they are working on, and that's why Noguchi showed interest in our 2 cases. They wanted to really find out because they are working on to see whether indeed the vaccine, it has to be different for the South African variant. We know that some scientists are saying no, it is the same vaccine that works. Others are saying no, it doesn't work for them. So all these are scientific things that will have to be discovered, and indeed they have to do a lot more work into that. Okay. There's so much that we don't know about the virus yet. So at the moment, every information we pick is important. The only thing is that we have to work on it.
Okay. If you want to ask Dr. Victor Vitus Annab BC, any question regarding coronavirus and you want to know more about it, whether you work around the port or you live around Tema or wherever you live across the entire country and even beyond, you can always reach us. The number on your screen for WhatsApp is 055-901-9177. You may also be able to call 020-552-8353. We do not have enough time for the call, so if you text, it would be more prudent in that regard. And then ask your questions. We will share them with the rest of the world. I see some numbers calling. So there's a 05918 number. You have been calling the WhatsApp number instead. Please try and text, and instead of calling, and call the number that is meant to be called. Doctor, let me ask you, what special thing are you doing now that we have new variants in the system? What next?
Yes, I mean...
Or are we following the same old protocols?
Thank you very much. Indeed, we are reinforcing the preventive protocols.
The old ones? Wash hands?
The old ones still, yes. Washing of hands and the running water, proper washing of hands. I always say that, don't do the fufu kind of hand washing. That's fufu and banku, no. Please do proper COVID-19 hand washing. One thing that people have forgotten, if you realize, last year, 2020, we never heard of cholera.
Yeah.
It's because Ghanaians, for once, have learned how to wash their hands properly. But cholera is what? It's a hand of what? I mean, it's a disease of death.
Yeah.
Okay? It's a waterborne disease. Food waterborne because dirty, you know, but because we learn how to wash our hands and keep our environment, probably that is why we didn't get outbreak of cholera as usual. It's one of the hypotheses anyway. But then, indeed, the hand washing remains. The social distancing or physical distancing remains, very important. But above all, please, wear your face mask. Okay. And wear it properly. Yeah. Stop touching the front part of your face mask. When you wear it, don't. Just if you want to adjust it as I'm speaking, if it's running down, all I have to do is to hold it by the strings, yes, and then use that to adjust, not to hold from front. But we are all tempted to hold the front. But what happens, if you have a virus, and it's on the surface of the mask, and you touch your hands, if you contaminated your hands. You get
it back in your eyes.
You put it back in your eyes, if you haven't washed.
It's good you have brought it up that way, because this morning, for several hours, I was talking to our former port security manager, Colonel Punamani, who had written something interesting, that it looks like those who, they wear beard, like I have small beard.
Yes.
Those who have
big beards.
The big beards, they stand at risk getting these things, because you see, often when you wear the mask, you put on the mask like that.
Supposed to cover your chin.
It's supposed to cover all this, but you see that the beard will be hanging around.
There. That's right.
And probably will be catching the virus.
The virus, yes.
And as soon as you remove this one, whatever the beard has been able to attract, your hand will just pick up and then it gets back into the... Is there some science in that? Is there some...
Well,
or it makes some basic
I think it makes common sense, isn't it? Even though no research has been done on that, I haven't seen any research on that, but I think common sense will say yes, because you see, the hair is there, and the hair is part of your face.
Yeah.
So if the virus has to settle on your face, you're protecting your mouth and your nose.
Yeah.
And if you're not wearing spectacles like me, your eyes are also exposed, isn't it? And then half of the beard is there. So if the virus happens to settle on your beard, as you rightly said, you can pick it with your hands. Yeah. And if you don't wash your hands, obviously those dirty hands or contaminated hands will go to your face, isn't it? So I think it makes sense. Yeah. So I don't know, but I think the young men especially love the beard, probably because the young ladies like it or they're admiring it. I don't know. Oh, but it will be better you trim your beards.
Easy.
And, you know, if you don't want to do clean shave, at least cut your beard to a size, you know, a good size.
The cameraman deliberately put it on me. He
thought that yours is not bad,
isn't it? I've cut it nice, and he wants everybody to see that.
So there are some, you see that the mask is covering half of the beard. The whole beard and chin is that so long. Yeah. And I think
what about glasses? They're saying that if you're not wearing glasses, the risks are also there. And that's why people are advising the face shield and all of that.
Yes.
The fact that we cover our nose and mouth and leave our eyes,
correct.
Does that put us at risk in any way?
There's some amount of risk and level of risk, yes. Because we know that if the virus falls on your eyes, the conjunctiva of your eye definitely you can get exposed.
Yeah.
The face shield, I must say here that if you're wearing face shield, it must be worn together with the face mask. People do the wrong thing by just wearing the face shield and it has become something fashionable. The face shield alone is not enough to protect you. You must wear it together with your face mask if you want to be protected. That's the point. So do not wear face shield alone. And those who wear spectacles, of course, it's difficult to wear the face shield on it, but you can try it. It's okay. But all we have to do is that there are multiple factors that we have to put in place to be able to protect us. The hand washing and the proper hand washing and the running water with soap, and also make sure that you keep sanitizing your hands. Where you don't have water, you must sanitize your hands. And as you touch objects, especially remote controls, your phone and other things, make sure that you're cleaning your phones constantly and really washing your hands and sanitizing. That is very, very important. Door handles, door knobs, remote controls. All these are things that even our computer keyboards in the offices. Busy typing and all that. And your hands can pick something. If you don't sanitize and you keep, that means that you can leave the virus on that. Okay. Yes, there's as you say, if you go around and you do research and you swap all those surfaces, you might come out with something. Let the researchers take that up.
Okay.
And then see what we come out with.
Okay.
Yes.
I'm picking international news real quick. I'll come back to finalize with you on a few things that you are currently doing, what you're doing next in the port. So let's go over the international news quickly, brief one, and then come back.
Offshore drilling contractor Maersk Drilling has received a conditional letter of award from Tullow Oil for the provision of the ultra-deepwater drillship Maersk Ventura and additional services for a development drilling campaign at the 10 and Jubilee fields offshore Ghana. Maersk Drilling said on Thursday, 4th February 2021 that the duration of the final contract is around 4 years with an expected start in second quarter of 2021. The estimated value of the final contract is approximately $370 million, excluding the value of the additional services provided and performance bonuses. The operation will be supported by local partner Rigworld. The Liberian Registry has become the very first ship registry to sign on to the Neptune Declaration on Seafarer Wellbeing and Crew Change. The Liberian Registry joins over 300 owners, operators, and maritime organizations in this very important worldwide call to action to end the unprecedented crew chain crisis caused by COVID-19. Signatories of the Neptune Declaration committed to act including calling industry peers and governments to recognize seafarers as key workers and give them priority access to COVID-19 vaccines and establish and implement gold standard health protocols based on existing best practice. A Singapore-based provider of smart tech and AI solutions for the maritime sector, Innovate1, has stated that the majority of the world's 4,900 ports are not yet using digital technology for even the most basic processes. According to Innovate1, 80% of ports continue to rely on manual legacy solutions such as whiteboards or spreadsheets to manage critical marine services such as towage.
Okay, so welcome back to the program. In the studios, Dr. Victor Vitas Anabs, BC, who is the General Manager, Health Services, GPHA. Doc, a quick one. What is your next line of action? Do you expect anything from all the private folks who, for instance, come to your hospitals or all the other corporate entities that you handle and all of that? Yes. Are you going to have special engagement now that we are seeing surge?
Yes, thank you, Sami. Yes, indeed. First of all, we are reinforcing what we started last year because we've seen that they are working. So all we need to remind people that these protocols still remain in force. Okay. And indeed, we know that the port, I think technically speaking, it is closed yet. It's not like the airport which is open. Mm-hmm. The port of entry, which is our port, I think the last time the president even made mention of it, that the ports remain closed, isn't it? But we are still doing business. Yes. So in doing business, our stakeholders...
No, I mean, he meant that made close to passengers who...
Yeah, that's what I mean, yes. Mean close, yes. Mean close to passengers just disembarking and entering the country. Because the point of country, as I said. So indeed, but we are still doing business. Yes. And indeed, it's important that we keep ourselves safe and all other stakeholders. So they know the protocol. We are very strict. People do not have it very easy now. Agents do not just get up and just board the vessel anytime the vessel comes. Those things are all restricted. Yeah. And indeed, our own staff, the marine operations staff, before they board any vessel, they dress appropriately, they use the appropriate PPEs, and we enforce that. And especially when we have a suspected case on board, we do not joke. Yeah. That vessel remains at anchorage. We call it quarantine anchorage. Quarantine meaning the word quarantine, as you know. So you remain there if you have a suspected case, and then we'll deal with you before Port Health will come in, and also because Port Health are major stakeholders in this business, okay? And they are part of the committee that I mentioned earlier on. So indeed, we are reinforcing that, and we intend to go around again, sensitize people, remind them that, look, indeed, this is what is happening, and also let them know that this current variant, the UK variant, is more deadly because it's more infectious. More numbers are getting sick. People are getting sicker quicker.
And so it's also more violent.
It's more virulent, yes. Well, because you see, by extension, if I have so many people getting sick, that means that the likelihood or probability of more people dying increases, isn't it?
Yeah.
If the previous one, the original variant, less people are getting sick, but now people are getting sick and even more severe. Their conditions are worse, isn't it? So more people are likely to die. And so the health facilities are overwhelmed. You have to do that to help with the health workers. We are the frontline workers. We are out to help you. Of course, that is our primary business. To do what? If we cannot even heal you or treat you, we should not make your condition worse. All we are saying is that we have taken an oath, the Hippocratic oath. Every health worker and every professional in the health industry, they indeed have ethics they work with, and everyone has an oath. So we are saying that please make it easy. If you have no business going out, remain home. That's the best prevention measure.
Good. Let me bring in this one and run it quickly, even though these days we don't have time to get responses, but this is very important. As you talked about the UK variant, somebody wants you to, if you know, give us the difference between the UK and that of the South African. This is coming from Maxwell in Anglonga, Volta region.
Yeah, what I know about the UK variant is that indeed, as I said, first of all, it's more infectious, or infectivity rate there is higher. So if you take, say, 100 people who are exposed to the UK variant and take 100 people who are exposed to the other variants, the UK people, more people get sick. Okay? And the time from contracting the virus to when you get clinical symptoms is shorter. Most of the time within 3 to 5 days. And of course, people get more sick. And the other one wasn't like that. The original one wasn't like that.
Okay. Let me bring this one also to your notice. It's coming from one Bismarck. It says, good evening, Iron Port. Please, the security personnel at the Eastern Gate, MPS, and other entry points are not checking apart from those at the headquarters. So maybe
they're not checking what?
It doesn't say. I'm sure that the temperature or something.
That's true. Actually, we insist that the security people should make sure that just not temperature, but they check that people are washing their hands and sanitizing before they enter. Because hand washing and sanitizing your hands is more important than even the temperature. From our little experience, what we've had from last year to now, we've realized that temperature in this part of the world, or at least in our port, let me put it like that, that it is not a key symptom of COVID. That if you take 100
we're always warm.
people don't even get fever.
Let me add this one, Doc, before, because I'm running out of time and I have just about a minute. It says, hello, I am Yal from Tema. I want to know, since we are to trim our beards to prevent COVID-19, does it mean we should also trim the hair on our heads as low as possible? Would that also mean, should we begin to have Sakura? Or the bald folks are at advantage? Okay. Well, this one says schools are recording cases, but they remain open with no shift system, whilst business firms and other jobs are doing the shift system. How's that making sense? This one says, good evening. What are the likely signs to be observed within the first few days, such as in 2 days' time of contracting the virus? Michael from Adentan. I'll let you respond to that quickly, and then
indeed, symptoms of COVID-19 are varied. It varies from different person to different person. From person to person, it's different. So what happens is that in the initial stage, sometimes someone can just come with just fatigue or even backache. I feel tired. I'm not feeling myself, and I have backache. Nothing else. So you can imagine something as simple as that. Or most people come out with symptoms of malaria and they say, I have malaria, joint pain, headache, fever. Meanwhile, the fever is now, you check the temperature is normal. So these are the initial things you begin to have. It's not like, we don't see too many of these coughs and then this running nose and the catarrh or the flu-like symptoms. Not too many of that. Another thing that I should caution people about is that some people, even diarrhea and vomiting could simply be a symptom of what? COVID-19. So we should be careful. If you have anything unusual, please report to the health facility.
Okay.
Do not try to do self-medication. Come to the health facility and we'll take you through, and then we'll get to the root of it.
Yeah, the news people are giving me a lot of signals. If I don't wrap up now, I'll get my query, but I have to appreciate your time that you spent with us, Dr. Victor-Vitus Anabisi, the General Manager, Health Services, the Ghana Port and Harbours Authority, always there to explain things to us, and we appreciate the statistics that you've taken the pain to glance us through it. It's very important. I wonder, I don't know, these are available? How can people get these?
Oh, yes, it's public information.
On your websites, on the Port and Harbours Authority websites, or what?
No, well, maybe for us
or as part of the GHS.
We have to give it to you. Of course, definitely, these are captured in the national statistics. But of course, they do not come out and say that this is GPHS statistic.
Okay.
They add it to the national.
So,
but I mean,
yes,
sorry to just this, that people should actually avoid close contact with sick people. Yeah. I know that we have that tradition. Somebody will say, you want to help, you want to do the person.
So what should they do then?
They should try as much. If they want to do that, they should wear their face mask at least and give the person the help.
Or
if they have gloves, they should do that. If they can't and they handle the person, wash your hands quickly. And then keep your rooms and your offices well ventilated. Thank you very much. Thank you. So Dr. Victor-Vitus Anabisi, MD, MPH, MBA, Health Services Management, General Manager, Health Services, Ghana Port and Harbours Authority. We've been talking COVID. Please stay safe. See you next time. Thank you.